Hi, everyone. The name's Nat, and welcome to Exceptional Individuals Thursday webinar. Every single week, to the end of time, we do engaging webinars around neurodiversity to help people better understand it and to make informed decisions on their life. ADHD in 40s. Now, why are we doing this? The main reason is if we look at our demographic for our community, we have a lot of people who are not really that surprising because a few years ago, ADHD was only considered to be for children. You grew out of it. The second you turned 18, bye-bye ADHD. And if you were male, you could have ADHD. If you're a female, you don't have ADHD. That's obviously completely false. And we have grown, changed, and developed over time. But what about all the people who got left behind? More and more people are getting diagnosed later in life. And it's not just that you're learning about it later in life. It's also that it affects you differently because your body has changed and developed. ADHD, attention deficit hyperactivity disorder, is essentially about chemicals in the brain, about how the brain is using them, reusing them, along with a lot of other factors. And as we get older, our bodies change as well. There are a few different factors. It also is different in men and women. We're going to be trying to reflect some of the nuances of that as well. Typically, we look at dyslexia, dyspraxia, autism, and ADHD. Today, we're doing a hyper focus on ADHD. Last year, we did dyslexia in 40, but actually, I'd probably argue that ADHD has a much bigger impact in different stages of your life than, say, dyslexia. Autism also is a little bit different as well. Now, here's a picture of me on the news. I always like to show people this because I'm big-headed and like the recognition. No jokes. It's just so you know who I am, why I am talking about this matter. Because let's just address the elephant in the room. I'm not a woman. I'm not in my 40s, and I'm not going through menopause, which we are talking a lot about today. Now, that being said, it is an area that I'm very passionate about, and I do teach and educate people on a daily basis. While I might not have lived experience in that sense, I do have experience in other areas. Today, I think we're going to gain a lot from it if we're sharing our own personal experiences and sharing best practice. Here's our lovely team. Today, you've got myself in the chat. You also have April, who's going to be recording and editing today. We're a lovely, April. We're a lovely bunch. I think like the vast majority of our team are neurodivergent. We're experts via experience, but we're also trained professionals in space as well. Now, as I mentioned, we do webinars quite a lot. Now, the last one we did was Do I Have Autism? And it's now on YouTube. I recommend check it out if you've got some time. It's lovely, nicely edited by April, and we go over all the characteristics of autism, how we might diagnose someone, the kind of differences between how we diagnose people in like Europe compared to America. So some nice differences there. Do check them out. Hi, I'm interested for myself and clients as I'm a therapist who works with MD. Brilliant. I'm glad. A lot of the time, professionals, they typically know it from one particular perspective or angle. It's great that you're branching out. This is always the most wordy slide you're going to see for the entire day. But there's a few kind of phrases just to make sure we're all on the same level. Let's crack through them. We've got late onset ADHD. Diagnosed in adulthood, typically over 40. Now, interestingly, if you are genuinely like 18, 25 onwards, that is considered late onset because most people get diagnosed in their childhood. Women get diagnosed a bit later, like teenage years. Anything over that is considered a late onset. Because when we think about exactly what is it, remember, it's a neurodevelopmental condition. Developmental means it happens really early on in life. If you get found out later, that's probably because no one kind of picked up upon it. Now, there is some really interesting research that late onset is actually a different condition. And while that is possible, there's a difference because late onset, does it mean it wasn't there before and now it is there? Or is it referring to it not being picked up on or not being observed before? So there is a little bit of a difference there. Then we got executive functioning. This isn't a condition. This is more of a characteristic. Those with ADHD often struggle with executive functioning, but you also can have executive functioning difficulties with a range of other conditions. This is like coordinating, planning, organizing, essentially life admin. So if you're someone who struggles with life admin, which a lot of us do, that's a classic characteristic. Yeah, it's tough out there. Then we got and this is acting without thinking. Again, really common. It is way more than just hyperactivity. And again, in adults, that's barely an issue. It normally transforms more into restlessness or being able to keep focused. Now, whenever people ask you about what are the benefits of ADHD, hyperfocus always comes up. And hyperfocus can be a good thing. I say can, because it essentially means when your brain is fixated and dedicated on one particular area that you are putting 110% into it, which sounds amazing. But all the other things around you are taking a massive hit. So while it is a positive, it also can have consequences as well. Then we've got morbidity, which sounds rather sinister. It's not. It just means if you have one thing, you're likely to have other. When we think of ADHD, unfortunately, when you're in adulthood, it comes along with sleep disorders. So I don't know if any of you have also struggled with sleeping. That's a really classic thing that links with ADHD. You've also got addictions, drug dependency, gambling, any of those things, you're at a higher likelihood. You're also more likely to have things, say, with dyslexia. Oh, okay, what we got here? We got Kat says, I found a course at King's College. At least that's the uni I go to, and talks about it. They real range between ADHD as an impairment and as a disability. Yep, I agree. We only get diagnosed when it affects our life enough to be a disability. Yeah. So many of us, while we always had the impairment and displayed ADHD symptoms, we were able to compensate in our early years. As we get older, we can no longer keep up the extra work. Yeah, Kat, I completely agree with you. It is only a disability if it affects your life in a negative way, if it stops you from interacting with day-to-day life. If it is just something you have and it's no big deal, not a disability. Is ADHD a disability? Is it not? I personally think it depends upon your particular environment, situation, and scenario. For some, it is. For others, it is not. Officially, it is. And that is a good thing. Oh, Anna says, on that note, a lot of us came out with more obvious symptoms, especially during the pandemic. That, again, isn't that surprising because it's all about circumstances. If you have a standard 9 to 5 every day, you're doing the same thing day in and day out, you've probably come up with a whole heap of support mechanisms. But the second your situation changes, maybe a pandemic, maybe a divorce, maybe you're moving house, maybe you got fired or you're trying to find employment, this brings a whole heap of new issues which weren't there previously. But yeah, really good one. What else do we have? We also have CBT, cognitive behavioral therapy. And this is your go-to, oh, you have ADHD, but you don't want to take medication. Try a little bit of CB. And while that therapy can be useful, I would say that it should be more tailored if you have ADHD, because some of the strategies just aren't as appropriate. I remember when I've got OCD and they gave me CBT therapy, and it was awful for me because it's all about checking in with yourself, understanding how you are. And that is the last thing I wanted to do because my brain was obsessed with how I was. I do agree there are benefits, but it needs to be tailored. Oh, we got. Vicky says a lot more children were picked up during the pandemic too, when there was more one-to-one with the parents. Yep, that's true. Our classes are really overstocked. And also during the pandemic, think about it, there really was probably not much to do. We also found that a lot of adults who had more time to reflect upon themselves and see their characteristics that their children may possess are the same with us. Okay, Jessica says, where do you draw the line between personality traits and symptoms? Good question. Personality traits, they're not negative. It just is what it is. But a symptom is something which I would say causes some sort of friction with day-to-day life. That is a good question. For instance, with autism, are you a person with autism, which is like a symptom of autism, or are you an autistic person, which is more of a personality trait? And I suppose the same sort of logic can be applied to ADHD. We've got medication. This is all about adjusting medication. A lot of time with ADHD, it isn't as simple as, okay, you have ADHD, have this bag of medication. Your body changes, how it processes, how it absorbs it, how long it takes to get into the system. So this is why you might have a stimulant, a non-stimulant. It might be why you might have a higher dose, a lower dose. You might have to change it up from time to time. Time blindness. This is when you struggle with time management, a real classic ADHD characteristic. If you're someone who says, deadline, I'll get it done, no trouble. And then you run out of time. You're like, I definitely planned it. Or you have a calendar and you still miss your appointments. Or you say, I'll be about 5 minutes and actually takes 20 minutes. Emotional deregulation. This is difficulty controlling emotions. And this, again, can be more impactful when the body is going through different changes. And the last one, RSD, rejection sensitivity dysphoria. This isn't just related to ADHD, but a lot of people with ADHD do struggle with sensitivity to criticism or rejection. And this is something which, again, can be more noticeable later on in life. Hopefully, we've done with all the complicated language now. We can actually get on to the other stuff. So at 40, now don't get me wrong, the second you turn 40, it's not like there's a massive change. It's more that once your body has stopped growing and developing, it's a little bit downhill. Not going to lie. The body is changing and maybe your life circumstances are different. So maybe you're well into your career now, or maybe you've got kids and things have settled down or whatever. You will notice that things that may not have been as noticeable start to become a little bit more known. And like I said, the main demographic we work with are exceptional individuals does tend to be people who are 40 upwards. And that's interesting because maybe they didn't receive support before and now they're realizing that, wait a second, maybe I could do with some support. So on this screen, all I want to do is find out whether or not you actually have ADHD. Who am I actually talking to today? We've got no or yes, but not diagnosed, or yes, but you are diagnosed. Everyone's welcome today. It just gives me a better idea. Interesting. A lot of you who said you do not have ADHD, I'm curious to know if that you definitely don't, or you think you might, but you're not sure, or you're quizzing, or maybe you're a professional trying to help people. Okay, yep. Okay, nice. A nice broad amount, which is good. And that is another thing, interestingly, that only 13% of us, yes, but are not diagnosed. We are seeing a massive increase in self-diagnosis. Now, whether or not that's right or wrong, I don't know. There's still a debate still out on that. But I do think it's often because, yes, basically getting a diagnosis is long, it's expensive, it's a traumatic experience for some people. But you still resonate with a lot of the characteristics that people who have been fortunate enough to get diagnosed experience. Okay, Tim says looking into it at the moment. Wow, we've got professional and also family members. Nice. My mum and my sister has ADHD and late diagnosed autism. Okay, there's a high likelihood that you may have it as well. It is useful to know that just because your family member has ADHD, you're not guaranteed to have ADHD. There's a higher likelihood because it is genetic, though there is always an environmental factor as well. Or Vicky says, I'm over 40 and not ADHD. Hubby is also 40 plus, as is his sister, and they both have ADHD. I'm definitely appreciating more about it and like to have ADHD free thanks to symptoms. My children also have ADHD. I'm not surprised that your children would because of the hereditary nature, but it is interesting that you might see similar characteristics in yourself, or just understanding that people, just like we can have cultural differences when you're in a relationship with someone from a different background to yourself, you can also have those same challenge or similar challenges if one of you are neurodivergent and the other are not. Or Sarah says, I'm curious, post 40 exactly, what are you all saying? I think possibly I may have always had it, but hormone changes have highlighted. Yes, Sarah, that is the thing. You would have always had it if you did have, but different hormone changes, personal circumstances can almost breathe new life. Quite often, the reason school is difficult for those with dyslexia is that it isn't tailored for their way of thinking. When you leave school, you do your own way of thinking. And that's why a lot of people then end up thriving afterwards. It can go both ways, both positive, negative, positive. Oh, LaDonna says, I once heard genetics is the gun, trauma pulls the trigger when it comes to ADHD. There is such a thing where something can be like, you have it's dormant, but then trauma can trigger it. Not the case all the time, but that's definitely, I would say there is truth in that. Okay, now if successful today, we are going to be looking at the following. ADHD and 40, even changes. And again, this is 40 plus. We're going to be looking at diagnosing females. Is it more difficult? Why are less people diagnosed with it? Are you more likely to have ADHD, or is it just due to psychiatry and the way that we currently observe it? We want to look at before your diagnosis. Is life a lot more difficult when you're not diagnosed? Does it get easier when you're diagnosed, or do you not really notice any difference? We're going to be looking at the reasons why someone may seek a diagnosis from 40 on upwards, because let's face it, you're probably done with school now. Why would you even bother getting a diagnosis? And there are many reasons. And also looking at what next. Okay, great. You have a diagnosis, but what do I do with it? Now, here's a nice little iceberg. And this, I probably don't need to tell most people in the room today, but while a lot of people think it's about being a bit restless, struggling to concentrate, that is literally the top of the iceberg. ADHD has many other things that come with it. And most of these are societal rather than genetic, but it's a mixture. We've got poor sense of time, all or nothing, poor impulse control, chronic unemployment, inability to focus on distractions, chronic paralysis. And a lot of these are quite negative, and there are positives with ADHD. And this will give me an idea because depending what decade you were born in, I think your understanding of ADHD and how you personally see it is going to vary quite dramatically. And this all comes down to understanding. Remember how I said ADHD was only considered for children and for boys when it first began, say, pre-50s. As we moved on, more people became aware of it. It's only in recent years where we understand various differences. It used to be, I think, before 2013, you could have now the diagnosis is simply ADHD. It used to be that there were only one form of ADHD. And now we've got three kind of inattentive, hyperactive, combined. You've got people looking down upon you for having it, stigma, discrimination, to now being quite common and talked about. The decade you're born in does have a big impact to how you receive it. Okay, oh, nice, got a lot of 80 babies. A lot of people from the 70s. Yep, that would make sense from this webinar. No pre-50s. A nice batch. Okay, what decade did I miss? Okay, I guess the 50s would be 50s plus. I just ran out of real estate. If you are like beyond that, I'm sorry. Before we go too much into ADHD in particular, let's just look at standard changes with age. For male, your testosterone production decreases gradually beginning around 30. Only 30, less down. And that means there is a chemical shift. Let's say you are on medication. Maybe you need to readjust it because your body is also moving about quite rapidly, not rapidly, but it is slowly moving about at that time. Sperm production does not stop. You keep on chugging for the rest of your life. Not all men experience low testosterone and sperm production. That is a kind of key thing to know. It's not as simple as all or nothing. Now, women, on the other hand, you have menopause, and this is when the estrogen, the kind of female hormone, starts dropping rapidly. You will notice that it'll be a very quite quick drop. Egg production stops completely. Women experience low estrogen and egg production. These are just basic things or changes. Now, don't get me wrong, these can be challenging at the best of time. Let's add ADHD to the mix, plus potentially medication, then you've got more to look at. On here, I want you to put a little pin, if you're able to, on one of the characteristics or symptoms that you potentially are experiencing right now. And these relate to menopause and andropause. Now, andropause is the kind of male equivalent, if you weren't aware. So you might have a lack of focus, low energy, and this is because your body is going through changes with the different amount of chemicals that it is producing. The ones on the left are predominantly female, the ones on the right are predominantly male, and the ones in the middle can happen to both genders. Now, if any of you wonder, what happens if you are another gender that isn't male or female? Honestly, I don't know. There just isn't that much research on it, but it is an area which I think potentially more research should be happening in. What about people who are non-binary? Does that have a different impact? Okay, everyone's going on the female side. No kind of male ones. Interesting. Yeah, there we are. Headaches. Yeah, all of these things are challenging. Again, we haven't even started to put ADHD into the mix yet. Yeah, you can only select one on this. If you have multiple, just go with the one that impacts you the most. ADHD, worsened at pre-menopause or andropause. For those of you who have ADHD, or maybe you work with someone who have ADHD, did the characteristics get worse or did they get better or standard? I'm curious to know, because remember, it doesn't automatically mean that ADHD characteristics are going to get worse, but that very well can happen to a lot of people. So at the moment, a little bit of a mixture. That's what I was expecting, to be honest. Slightly more than not. Okay, worsen. I remember ADHD is a consistent. It doesn't really get worse from maybe a genetic level, even though there is a difference there. It's normally about how it presents itself. Okay, worse. Yeah, it makes sense why a lot of you are there. Now, are there any other changes from 40 upwards that you have been aware of besides ADHD? And this all impacts into the wider picture about how we might navigate our brains as we get older. This could be social living. It could be family moving on, any sort of life events which you think might mean that ADHD suddenly becomes more prominent, or maybe it's more obvious, or maybe you start to question it more. Yep, divorce. Divorce sucks. Not experienced it, but I've seen it. And that is a big change because suddenly where a lot of neurodivergent people and neurotypical people, we balance each other out. Suddenly you are back to fending for yourself again. And the things which were compensated for suddenly become a lot more obvious. You got struggle to communicate when activated. Yep. Divorce, embarking in future studies post 40. Yep. The support just isn't there. And let's face it, universities are really stingy when it comes to giving support. Typically, they require a diagnosis. And when you're over 40, the likelihood of having a diagnosis is a lot less. Got menopause cut down in a different country from where I used to live. I feel a lot of neurodivergent individuals really struggle with and are still struggling with the consequences of it today. Children entering adulthood, yep, different needs. An empty nest, miscarriages, divorce, bereavement, crisis, having young children moving house, made redundant. That is actually, unfortunately, quite a common one that we deal with. An example is maybe you have worked in, I don't know, a more manual trade your whole life, or you're getting on a little bit, you can't do the same jobs that you used to do, and trying to find new employment afterwards is really difficult. Having to retrain and regrow and keep up with people who have learned those skills from day one. Or Jessica says, my boyfriend didn't know he had ADHD until he took a tablet, which was supposed to help him focus and study, and he fell asleep. That's an interesting one. If any of you aren't familiar with the medication, if you do not have ADHD, you really shouldn't take the medication because it actually can give you ADHD characteristics or symptoms if you didn't have it. So yeah, be mindful of that stuff. Oh, we got, for me, the biggie was retirement. Through redundancy, close to pension age, can't manage without the structure a job provides. That is a really good one as well, because jobs do give you structure. I find pets are also really good for structure as well. Having that kind of routine where you know that if you weren't to do something, there would be consequences. Returning to work after bringing up a family member as a stay-at-home parent. We have a lot of additional factors to take into consideration. While, yes, we are talking about different chemical balances in the body, we're also talking about real life as well. Oh, I could never understand why my husband found Coca-Cola helped him to sleep. It was only post-diagnosis that we realized that it was the stimulant in the caffeine. That's interesting, actually. But yeah, it's one of the reasons why we talk about the relationship between addiction and ADHD. The body does always try and balance itself out, even if it can't always explain why. But you can see why this could be a slippery slope. One of the big things that comes up time and time again with ADHD is that more males have it than women, or are more males diagnosed with it. And there is a difference there. There is a bias in how we diagnose individuals. Typically, when we think of ADHD, for whatever reason, hyperactivity has more weight to it. That probably comes down to the fact that when it was first recognized, it was predominantly fixed around hyperactivity. And people are slow to change and adapt. There's also this thing, and I'm curious if any of you have ever heard of it before. It's called the female protective effect. And I'll talk a little bit more about that in a second. But how does that relate to ADHD? I'm loving all the comments, by the way. Really great. Debbie says, peers tend to say, oh, we all have a little bit of ADHD. I think social media for highlighting ADHD is also making people all expert and are not supportive. Yeah, it's not like you have a little bit of ADHD. ADHD is you. It can affect people differently, but we're not all a little bit. It's like when people say, oh, I have a little bit of ADHD, no, a little bit of OCD too. No, you don't. It's really difficult. You do not have it. I always find it easier to mask. Absolutely, Jessica. Masking, camouflaging, essentially pretending to be typical is more common in women than males. So back to the whole protective effect. There's a really good book on it called Invisible Women that I recommend checking out if you have some time to read it. And it looks at mutation responses. And is there a difference in ADHD on a genetic level from male and female? The jury's still out. Honestly, there isn't enough information to make a kind of conclusion. Then we're looking at the protein. Again, protein, we still don't know. It's really complicated to find the ADHD gene, mainly because it probably doesn't exist in, balloons. It probably doesn't exist in the sense that it's one particular gene. Quite often it will be a number of genes affecting people in many different ways. We've got behavioral coping. And this essentially is what you said, Jessica, about masking. It's about being able to find your own strategies. And women tend to find strategies a lot earlier on. If you found your own strategies, why would anyone offer you additional support? Because you've clearly got this under control. Then when those support strategies have been taken away, either through retirement, new career, whatever, you then realize that you need help. Suddenly, the help is no longer available. And also, girls with ADHD have different symptoms, coping, and mechanisms, or how they deal with it. I would always say, if any of you are thinking of getting a diagnosis or coaching or CBT or therapy, always ask if the person has had experience with women with the condition rather than just males, because they will have bias even if they're trying really hard not to have it. Now let's look at some menopause research. This is really interesting, by the way, and also very cutting edge. This isn't something that has been that well explored until the last decade or so. We've got symptoms. It is common for women to find ADHD becoming more prevalent in terms of how it affects you on a day-to-day. We also have an information gap. And if you are trying to research real, legit information on menopause and ADHD, good luck. It is far and few between, and there's a lot of fake news out there. Be careful with the information you seek and always try to find sources and resources. Communication barriers. A lot of people do struggle to talk about the menopause. For some reason, it's considered taboo, or people like to talk about it, or doctors might have very little knowledge in that area. We've got distinct symptoms. So a lot of the symptoms that you may experience do not affect those who are not going through the same menopause. So you can see why it's even harder to pick up upon. We've only gotten to a place in history now where men and women are more or less treated equally with ADHD. We haven't gotten to the point where we've been experiencing different stages in life and how that may affect you. I also mentioned that GP's knowledge is still quite limited when it comes to these comorbidities or co-occurring factors. Oh, what do we got here? Are these slides available? We are recording today and it will be uploaded on our YouTube channel within a week. Absolutely can recheck it out there. If you do want the slides for any particular reason, email me directly and I'll be more than happy to send them to you. Okay, Vicky says there is a link between estrogen levels and things such as concentration, memory, focus, etc., which is why many ADHD traits may seem to get worse. Yep, absolutely right there. These things do all link together. Ooh, okay. Now, remember when I asked you what decade you were all born in? A lot of you did say the 70s. And this is a very interesting decade because it is one of the pivotal decades when it comes to ADHD knowledge, research, understanding, and a shift in culture. First of all, it didn't exist back then, did it? It existed, but yeah, it didn't as well. Things are changing all the time. During this time, we did see that medication was starting to be used. Stimulants, more stimulant treatment, research going on. And what makes interesting is it's not an exact science ADHD medication. And what do I mean by that? Of course, it does work, but it's more of a scattergun approach or a wide net. Why your body experiences ADHD symptoms can be a number of different factors, from how our body is absorbing, reuptaking them, releasing them, and it's a bit more of a trial and error approach. So not everyone is going to benefit from stimulants, and some people would benefit from different dosages. This was the very start of it. And you often hear that a lot of people talk about, are we overprescribing people? Are we just giving medication to everyone these days? The answer is yes, we are. But the answer is more difficult than simply, yes, we're overdiagnosing medication or distributing it. Because the amount of people who would still benefit from medication who do not have access to it is far greater. The issue isn't as big as maybe the media likes to make out. I know as a joke. Well, just because I saw on the news yesterday, there is a shortage and people have to ration out their tablets. Yeah, that is a real issue. And I'll tell you, the number one reason why ADHD medication does not work is that people are not taking it correctly. You can't just start and stop. Even if you think, I want to come off of it now, I'm ready to not be on it anymore, you have to talk to your GP, and it has to be a gradual approach because your body has been redistributed with the chemicals. And when you haven't suddenly stopped using it, there's a massive shift, and that can actually make matters a whole lot worse. This is why it's such a big issue, because it's about consistency. I take medication for my OCD, and if I do not take it for even one day, I honestly do notice the difference. Okay, I heard that about 80% of people who have ADHD are undiagnosed. I can very well believe that, to be honest with you. Debbie says, my sister is a research assistant in a university and is out of medication due to shortages. She is considering that she may have to take time off. That's honestly really sad. And we hear very similar stories again on the day-to-day. Very difficult to get the medication. In the 70s, we also got awareness versus misidentification. Increased ADHD awareness, but often confused. While more people are talking about it, they would like ADHD, ADHD, even though some people did not have ADHD, so were not receiving the correct support available. Then we got research evolution, new ADHD theories and studies starting to merge. Finally, women can have ADHD too. Adults can have ADHD. It can affect people differently. It's not one size fits all. Then we've got different hurdles. There was limited understanding and support in school. If you had ADHD, teachers didn't know what that meant. They would just probably stick you in a class with all the underachievers and hope that somehow you magically improve. So the gap between those who have ADHD, who were succeeding in mainstream education it wasn't great. And my experience at school, while not the 70s, I resonate quite heavily with. You see, there was a lot happening in the 70s, and also the standards. In the UK, we use the ICD-11 now, but in the US, they use something called the DSM. And we are currently on the 5th edition, but in the 70s, we were using the 2nd edition. And that was really basic when it came to explaining what ADHD was. Even professionals had very limited knowledge, which they could officially use in order to understand it. Then moving on to, actually, wait a sec. I'm pretty sure that probably should be the DSM-3 era. Even as we started changing over to a new understanding of it, it takes time. The DSM is an interesting book. Like, for instance, if you look at the DSM-2, I believe that homosexuality was still in it, and you can see how backwards that is. The document is our standard go-to, but it is still very much a work in progress, and it isn't updated that often at all. Moving nicely on to treatment options. Does treatment change in later life? Yes, it does, because the dosages you might take for medication might be different. You might look at more natural supplements. There's also therapies. Again, we talk about CB. Also, something which I wasn't aware of before doing this, I must admit, is the transactional magnetic stimulation. And this is a non-invasive procedure that uses magnetic fields to stimulate specific regions of the brain. I have no idea of if that works or doesn't work. I don't know if any of you have had experience, but the key thing is there are more than one way because medication isn't right for everyone. And I tell you, even though I am not a doctor, so don't listen to me, from my experience, I find the best approach tends to be a combination of things rather than relying so heavily on just one miracle solution. Okay, back to a question to all of you. When were you diagnosed or suspected you have ADHD? So just put here a number, like what age? And I'll be curious to know if a lot of you were diagnosed early on or later. Again, I also put suspected because I appreciate not all of you would be. And if any of you do not have ADHD, some with ADHD really well, put their numbers instead. Okay, we've got 52, 38, 30. Oh, okay, apparently it's getting popular in the US, 45. And I tell you, just a few years ago, you would not have got diagnosed at this age. It just would not have happened. But now it is. And whether it's because there's more understanding, more awareness, because people know about the genetic link, how it runs in families, because people are working for much longer, because we have a higher level of healthcare, arguably, there are a number of reasons why this might be. Realize that 57, I've even had people who have got diagnosed in their 80s. And you might wonder, what is the point? For a lot of people, it helps put your life in context. It helps you understand the struggles that you've been through. Let's face it, I'm sure a lot of us have considered or been told we're stupid or dumb throughout our life. And that is because we don't conform to the standard way that others do, even though that's not true whatsoever. A diagnosis may have less impacts in terms of the support you can receive, but sometimes it might be what you personally need in order to make sense of your life. Or Tanya says, I suspect my 78-year-old mum has it, but I've never been diagnosed. It's very possible as well. And I said, in that case, you've always got to weigh up the pros and cons, because while a diagnosis can be really beneficial, it's also quite time consuming and it can be expensive. So you've got to think, what do I hope to gain from it? What is my expected outcomes? Now, for those of you who have been diagnosed, particularly maybe later on, I'm curious to know what life was like before your ADHD diagnosis. And this can be both positive, negative, or neutral. Maybe there was no difference whatsoever, or has it been a game changer? Because I often get asked by individuals, should they seek a diagnosis? And I really struggle to answer. Understanding this a little bit more, if you think it was worthwhile, if this does relate to you or not at all. Okay, Linda says game changer, totally. Why, Linda? Tell me, what was the big change? All right, we've got, it wouldn't be worth going through diagnosis. It wouldn't change anything. It has to be recognized in the childhood. Yeah, again, I said the reasons aren't always black and white. Okay, so it was chaotic before, constantly feeling a failure and struggling to complete things, felt exhausted prior to a diagnosis. Now, did that change because of the support strategies they put in place, or did just knowing that something wasn't your fault and there was a reason behind it just have an overall benefit? Completely exhausted, my confidence shot up because I had answers. That is the one that I see time and time again. Unable to study, finally being able to understand myself, work on how to get rid of the shame. You say a lot of the things here is how it helped you in a more of a societal way than a genetic way. Still exhausted, but listen to my body now. That's a good one. See, all of these are, I think, really useful information. So if anyone ever said to you, what is the point? I think these reasons sum up really nice. Steve says, for me, it was a huge difference. I couldn't understand why I couldn't do things others could, why I was always tired, helped other people understand why I do the things I do. And now, Cyrus, I really appreciate all of you for being so honest and open about this. It seems that we're all very free to talk about it because this is a safe environment. There are a lot of people who do not understand it still and like to interject with their own thoughts and opinions. I'm curious to understand what can you do about it if you are diagnosed. The only real difference is you then have access to medication should you, one, be able to afford it, and two, feel that benefit. I don't know if GPs are able to prescribe it without official documented proof, but tell me if you know the answer to that. CBT, coaching, etc. This one kind of is a little bit similar to what a lot of you have already said, but curious to know what was your motivations for a later life diagnosis. Did any of you do it purely because you wanted access to medication, or was it for your own personal understanding? Or did you do it because other people kept saying something that you probably should get it done? Did you do it because you wanted to make your child feel like they're not alone, particularly if they also have ADHD? Or Vicky says, I don't believe so. It usually is done as a shared care with an ADHD clinician. Yeah, I thought so. I understand more and beat myself up less. Oh, that's good to hear that you no longer do it. We've got, okay, motivations for a later life diagnosis to get my life back. My life was falling apart after childbirth. That's an interesting one as well, because that's another really big pivotal shift in your life. To understand myself and explain to others, that can really help as well. I try not to lean too much on my neurodivergences when I make a mistake, but sometimes it can help people have a bit more empathy that I am putting in a lot more effort than they might do in that same situation and still struggling to get the same expected results. I was being put on higher and higher antidepressants and they were not helping. There is a real big issue with overprescribing antidepressants. And often if someone doesn't know what's wrong with you, they'll just give you generic when actually maybe stimulants or anti-stimulants, non-stimulants might be more helpful. Wanting to try medication and get better understanding, to not beat myself up, not diagnosed yet, but considering it because something is seriously affecting my ability to do my job. I would say though, if you suspect it might be ADHD, do look up soft support strategies that could benefit you, because even if you did or you didn't, a lot of the strategies could still be very useful. I have an understanding and use strategies to help. Yeah, understanding is a real big one as well. I saw a diagnosis for medication, and whilst it worked with improving focus, I hated the other parts of it. Yeah, the classic feeling a bit more zombied, feeling different. I would say often that is about the medication, the kind of the dosages, and do know there are multiple types of ADHD medication. So if something isn't working for you, talk to your doctor because they might be able to try out other areas. We've got Eva says, I did it to try to understand myself. I was diagnosed 43. I thought I'm diagnosed, I could help my children as a teacher might take me seriously when I say my daughter needs support because her brain is like mine. I'm still processing my diagnosis. It was only 6 weeks ago. Congratulations on having it. And I really commend you for your reason to help your children as a result. There aren't many adult role models when it comes to ADHD. If you are a parent and you're able to say to your child, I also have it, it's going to be okay, I'm sure that would be really helpful. So some of the reasons, which a lot of people say, is to overcome trauma, to get a better understanding, to educate yourself, to get support because your child was recently diagnosed. There are so many different reasons. It doesn't simply have to be the fact that you expect some sort of additional support via the government or your doctor. It can be much more complicated than that. We've also got lots of celebrities that are now speaking openly about their ADHD, which can only be a good thing. We've got will.i.am from Black Eyed Peas, very much talks about it and how it affects his producing. Ryan Gosling. We've got Ty Pennington, who does like DIY channels in the US. Channing Tatum from Magic Mike. Justin Timberlake, Jim Carrey, who is Dr. Robotnik. Lisa Ling, Howie Mandel, I believe from one of the American Got Talent things. Pete Ross, who I believe is a baseball player. So we've got lots of people who are opening up about it. And you may notice most of these are male. I still think we have a long way to go to get a real representation for people to realize that there can be benefits from having a differently wired brain. We are making progress. A quote from Channing Tatum says, my mum said, be a sponge, and I've always learned more from people than I have from school or from books. And this is a really standard ADHD response, to be honest, that the education system may not be the best approach, but you might learn from other methods, such as word of mouth, communicate, seeking information in different formats. What do you now know about ADHD that you wish you knew sooner? As someone who teaches people about ADHD all the time, I would love to know, what should I be teaching people? What key bits of information do you think make the biggest difference to someone's life had they known it sooner? Okay, how it can affect adults over 40 as well as those under 40. So yeah, knowing the differences. I think often you think when you get older, it's just disappeared. It does not. To call out shaming behavior within neurotypical worlds, there's so much than hyperactivity. Yep. And that's another thing. Just because you have a diagnosis, it doesn't mean you're an expert in it. Often you have to go out of your way to teach yourself these things. Hyperactivity in children could be showing more like restlessness in adults. Yes, that is a really big one. The amount of people who say you don't have ADHD, just because your kid has ADHD, it doesn't make you an expert in it. So don't be shaming other people. That symptoms change with age. Nice. Well, I'm pleased to say these are all things that I regularly talk about. But if any others come to your mind, let me know. We're always looking at developing training and understanding. Although it feels like a hindrance to have, it can also allow you to be more actively creative and give yourself permission to be different and mask your symptoms less. Thanks. So in terms of support going forward, if you are in the UK, see the NHS. They are bloody slow, but they are good at what they do when you do get the support available. Medication isn't for everyone, but if you do look for the medication route, know that there are multiple types. So if one doesn't work for you, go back and see what other ones might be more appropriate. Therapy can be really useful. I personally would recommend finding someone with experience with doing it towards the ADHD community. Groups like on Facebook, online, even ones like our group, can be really great in feeling a sense of community. Specialized clinics can be quite useful. For instance, there are very specialized, but ADHD and addiction groups are going to be far more useful than just a generic group, and workplace accommodation. Now, if any of you thought today was interesting, I'd love to learn a little bit more, I would recommend this book by Thom Hartmann called Adult ADHD. And it goes into a little bit more from the adult perspective, which a lot of books focus on children. You do have to really scout out the information if you want to see the most relevant form of it. Yes, really, Access to Work in the UK is a really good government grant, and I definitely recommend that if you're in employment. We did mention Access to Work. If any of you are employed and in the UK, contact exceptional individuals, because we are able to get you free support in the workplace. And it can be like several grand's worth, and it can be coaching, mentoring, equipment. It does not and cannot pay for medication or a diagnosis. Even if you are undiagnosed, you can still get support available. It's a really good alternative, particularly if you aren't able or do not want to seek a more official recognition. And if you enjoyed today, which fingers crossed you did, our next webinar is how not to talk to a neurodivergent person. We're going to be looking at the classic things that people say all the time. Oh, a little bit ADHD, or yeah, just take some medication. All the kind of classic things. What are people saying? Why is it bad? And how might we want to talk about it or respond to it going forward? Is there a direct link to the work grant? Yes, there should be, Victoria. Let me quickly grab them up. Individuals looking for support, workplace needs assessments, and let me post it there. There is a direct link for the workplace needs assessments. And quick question here. Can you put your contact details on screen? Oh, it's like you know what's coming up next. Oh, check out our YouTube if you want to watch this online. All you got to do is click the little subscribe button, and look, we've got lots of lovely videos, and we have a lot on ADHD. So do check them out. I think if you go like ADHD and go for a search, you'll see that we've got the history of ADHD, the science of ADHD, understanding ADHD and drugs, looking at the future of medication, ADHD in the workplace. We have a whole heap of information for people to research. And in terms of contacting me, my name's Nat, that's N-A-T. So email me at nat@accept.co.uk or exceptionalindividuals.com. And I'll be more than happy to answer any questions, concerns, or queries. Or if you just want to get in touch generically about a workplace needs assessment, admin is a great one to go to, or via our website. Thank you everyone so much for attending today. I really hope you enjoyed it, got a little bit out of it, and I really appreciate you being so open to discussing this subject, which I appreciate can be a difficult subject to talk about. All right, everyone, we are done. We've made it to the end. Hope you enjoyed. Happy Thursday. And once again, thank you so much for your contribution. Thanks, Ian. Really been great having you all. So yeah, see you next week, hopefully. And do check out our Eventbrite. We have lots of great events every single Thursday. Thanks, everyone, for the lovely comments and feedback. Always appreciated. And on that note, I'll say goodbye to you now.